what determines your breast size anyway? Like, what actually determines if you have large breasts or small breasts? Now, I know you're here to find out if big boob pills, big breast supplements actually work. I'm going to give you the answer. But let's start by level setting, okay? What determines breast size? Well, a lot of it's genetics. And that probably should make sense, right? You think about it, so many parts and aspects of our body and our health are dictated often primarily by genetics, from our underlying conditions to our hair color, our eye color, our height, and so much else. Our breast size is very heavily influenced by genetics. But I would also say that for many people, our weight makes a difference as well. Many people notice that when they gain weight, their breasts enlarge. When they lose weight, their breasts get smaller. So that's something as well. All right, but now let's go on to these big boob, big breast supplements. And child, they are all over the Google Schmoogler. I know you know it. And you've probably been wondering, all right, so what's the deal with these? Do they actually work? All right. There's no reason to prolong the answer, and I'm not going to keep you watching this video just because. So I'm going to come right out and say that no, they don't work, okay? There's no good evidence that says that these pills work. I don't want you wasting your money on these supplements. But don't turn off the video, please, because I'm going to tell you why I say this. I'm going to tell you what does work, and I'm also going to give you and tell you some potential dangers of having large breasts. So see, y'all don't want to go nowhere. All right, so coming back now. These pills don't work, okay? I know it might seem disappointing, but remember if it seems too good to be true, it very well just may be. Now, many of these big breast, big boob supplements have herbal, sort of herbal products, herbal ingredients. I've seen things like saw palmetto, wild yam. I've seen black cohosh, so many other things, okay? Remember, just because something seems natural, which many people put those ingredients in the natural category, just because something seems natural doesn't mean it's safe, okay? Remember that many of the ingredients I just mentioned 3, but there's so many other ingredients that these supplements use, they can literally interact with medications that you're on. Whether you're on blood thinners or blood pressure medicines, heart medicines, other medicines, kidney medicine, let me tell you, the interactions that these ingredients can have with medications you're on can be potentially dangerous. So remember, it's not just benign to take these medicines. The second thing is many of these ingredients, even though many people think of them as natural, they can actually have side effects in and of themselves, okay? Just like prescription medications can have potential side effects, so can supplements, so can herbal ingredients, botanicals, vitamins, supplements, etc. Okay? Same thing goes for this. There are potential side effects. The other thing I'll say, I'm not going to get on a huge soapbox in this video because I got plenty of other videos where I go on a soapbox, is that the FDA does not tightly regulate these sort of botanical, herbal supplement type products. It just doesn't. And what that means is that there are a lot of holes often in the knowledge that we have about them. Exactly what's in them. Sometimes we don't know. They're not well studied. Oh, the list goes on and on and on. I'm not going to go down that road. But for those reasons and others, no, I don't recommend buying these supplements. No. And the larger fact is we don't have good evidence that suggests that they work. All right. So now you're saying, well, what does work? All right. Well, what does work is breast augmentation, a boob job, breast implants, or whatever procedure plastic surgeons do. I'm not a plastic surgeon. I'm not telling you to get this. I'm not advocating for it. I have no problems with it when done in the right patient that's properly evaluated by a board certified plastic surgeon, yada, yada, blah, 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 blah. No, I have no issues with it. In fact, I believe that self-enhancement, if that's what you choose to do, is perfectly within your right. Okay. What I'm saying though, is that at least is a fully evidence-based way to enlarge breast size, and one where we can more accurately and better sort of evaluate risk versus benefits. Okay. So yeah, breast enlargement, okay? And there's many different ways to go about that, I imagine. Breast surgeons and breast, plastic surgeons, they'll be able to talk to you about that if you want that information. Now, let me also just sort of mention some potential risks of having large breasts. And this is not to criticize or what's the word I'm trying to think of? This is not to, what's the word? This is not to make any people out there with large breasts feel any kind of way. This is actually, I'm speaking from a medical standpoint, okay? This is not an opinion that I have. This is my experience as a physician speaking to many of my patients who have had large breasts, who talk to me about some of the symptoms they have. So there can be side effects to having large breasts. Many of my patients talk to me about it all the time. And I've had a number of patients over the years have breast reductions because of some of the issues that they have. Things like, the digging in of the bra strap, because their breasts are so heavy, it literally pulls on the side of the bra strap, where literally I have patients with dents in their shoulders from their bra strap from the heaviness. Back pain, neck pain, shoulder pain, not feeling like they can work out or wear certain clothing, feeling so many different ways. I have a whole video on some of the potential health risks of having large breasts, which I guess is what I'm trying to say. It's not to anyone's fault. We know that people who have large breasts, genetics is a large part of it. No, it's not their fault. But I want people to have some compassion and understanding for when we see people with larger breasts, that sometimes it can actually be quite tough, okay? And for those of you who may want larger breasts, I want you to know that too. Remember, everything has risks versus benefits. So as you weigh the different options, or you talk to your plastic surgeons or whatever, I want you to be thinking about different ways that larger breasts actually may affect you, and not assume that it's always a good thing, okay? In this society that we live in a society that favors big breasts and big butts and, all this kind of stuff. But the truth of the matter is, I don't think there's enough talk about sometimes how these things actually affect someone's physical health and their emotional health. And it can actually be a big deal. So, hello, this is why I'm here, Dr. Jen. Hello, we're talking about it because somebody needs to. So check out the link video. But just understand, as I've said in some of my videos about penis size, and some of my videos about can you get a larger butt with supplements, remember you're perfect just the way that you are. You were made the way you are, and you are perfect. And I have no problems if you would like to make some changes. I don't know that there's many people on this earth that can't say that they wouldn't like a bigger this or that or that. There's no shame in that. And I don't criticize you if you'd like to make some changes. I just want you to know that you're perfect the way you are. If you'd like to make some changes, please do so in an evidence-based way that is safe by board-certified physicians that are appropriate. That's all, okay? Get my drift? Let me know. I want to know what you think. Let me know if you've tried any of these supplements, which I don't recommend, but I'm not going to criticize you in the comments if you write that you have. A lot of people have. That's why companies sell them. Let me know if you've tried them. Let me know if you've had a breast augmentation. Let me know if you are happy with your breasts, if you want bigger breasts, if you got bigger breasts and are happy with them, not happy with them. I want to know. Write it in the comments. Also, check out some of my linked videos as well about this topic. I'm Dr. Jen. It's good to see you. Practicing family physician, honor your health expert, and video creator. Please like and follow my page on Facebook. Please subscribe to my channel here on YouTube and click the little bell. I'm on TikTok, Instagram, LinkedIn, WhatsApp, etc. at Dr. Jen Caudle. And please sign up for my free weekly health newsletter at Dr. Jen Caudle. Guys, I hope this is helpful. I love you. And yeah, I'll see you soon. Okay?